right, I think for the sake of time we get started. We have a couple more empty chairs which are going to be filled up in the next couple of minutes, but as we do need to stick to our given time frame, we're just going to go ahead and kick off the session. So it's my big pleasure to welcome all of you to today's PROLLENIUM session, which has the beautiful title, Elevating Asian Beauty Through Precision and Subtlety with the Revanesse Portfolio. And I think this is a very fitting title for the theme and also the spirit of this year's IMCAS in Bangkok, as we are kind of progressing in the field of aesthetic medicine, and we're witnessing a certain evolution of how we look at our patients, how we treat our patients, and also how our patients are looking at us and our treatments. Now, despite previous trends in last decades where we tried to add more and more and more volume and alter more and more the identity of our patients, we're now in an age where really the highest level of expertise is not anymore a complete transformation, but rather the invisibility of transformation. We do want to create a better looking version of our patients without leaving traces. We want to work on the subtlety in our field. And here is a AI prompted before and after of an Asian patient, which kind of shows a result we do not want to kind of create these days anymore, because there are so many telltale signs of a badly performed aesthetic treatment journey right here. It's an overfilled midface, it's overfilled lips, it's unbalanced. So we're kind of shifting this old paradigm in aesthetic medicine, the era of volumization, into an era of precision. Back in the days, it was all about augmenting the tissue, giving more projection, giving more volume. There was a volume first logic that we adhered to, and symmetry was one of our outermost goals. And we're seeing this kind of shift right now to what we call a structural modulation, which means that we need to work more precise, that we need to optimize proportions rather than completely changing them, and we want to keep the dynamic naturalness of our patient, which becomes of uttermost importance when we speak about nonverbal and verbal communication. So patients have changed. When they come to our clinics, they want to look like the best version of themselves, not like somebody else. The amount of times patients confront us in the office these days by showing a photo of a completely different person are over. They're showing us small traits or bits and pieces of other faces where they say, how can we move in that direction? So our patients are becoming increasingly informed about what they actually want. And while this is a very positive trend, we need to be aware that this also requires us to get a better and deeper understanding of our patient's anatomy at the end of the day. Then there's also a significantly higher ethnically awareness of what we're doing these days. We're kind of confronted with results from our colleagues all over the world on social media. We need to be aware that this ethical and ethical awareness that we're seeing these days is kind of really moving into our daily practice these days. And then there's something which has also changed in the last decades. We always had different modalities, but the amount of treatments we can choose from these days has increased significantly. So it's not only one tool that we do have at our hands, but it's rather a whole toolbox that we need to use precisely in order to get natural results. The four pillars of contemporary Asian aesthetics, as defined by many colleagues in a board, was restraint. There's this idea of less is more these days. We do want an undercorrection in some sessions and reassess a couple of weeks later, because we do want to avoid those overfilled faces. There is a strong anatomy-driven planning going on in all treatment journeys that we see these days. And this has the ultimate goal to really preserve the ethnic identity. We do not want to westernize Asian faces anymore. There is a very strong Asian idea of beauty, and obviously this is differing between different countries and parts of Asia. It's not one Asian beauty ideal, but we're moving away from this westernization, which often has been pushed on us by kind of adhering to westernized education beauty models. At the same time, we're also getting more and more technology integration. So we're having not only fillers, but we can use neuromodulators, collagen stimulators, and also EBDs in sequence, rather not isolation, to get the results we do want. So the whole benchmark that we're facing these days is that we're having an undetectable result, but this undetectable result needs to be reproducible. We want to have an evidence-based clinical achievement for our patients where we can also rely on what we're doing is doing the actual job that we want it to do. So the natural outcome that we're kind of perceiving and hunting and chasing these days demands significantly more technical skill than previous interventions, which have been based on isolated protocols or certain injection points. And we need to understand that our treatment plans these days shouldn't be solely based on one treatment only. So we do have neuromodulators, which take care of the dynamics. Then we have fillers, HA fillers, which are important for the structure and contour. We do have collagen stimulation at one point in our patient journeys, which help us to regenerate, while energy-based devices like lasers, as we've just seen before, work on skin quality. All of this, however, takes constant review. So it's not a one treatment fixes it all forever for your patient, but it is rather a planned treatment strategy that we try to give our patients in their aesthetic journey. And the important thing with all those treatments, especially with fillers, to create those natural, reproducible, beautiful results is anatomy from my point of view. So if we look into our injection treatment protocols, at the core of everything stands anatomy. Anatomy is our basic pillar and foundation because it really also tells us what has been changed in the past in our patients. So the aging of the midface, for example, is mainly driven by a change in subcutaneous fat. The subcutaneous fat starts to atrophy but also descend in specific locations all over our face, namely the superficial nasolabial and the jowl fat compartment. We can see that there is a deflation and at the same time also this kind of downward trend that we see, which then accumulates in the clinical formation of nasolabial fold and jowling or marionette lines. And this becomes most visible rather in the medial part of our face and can at one point also unshadow certain changes which are going on below our subcutaneous fat, i.e. the muscles. The muscles are changing as we get older, that they are becoming more of a static issue, which means that the dermal insertions of our especially perioral musculature start to create certain barriers and boundaries where superficial fat starts to prolapse over and accentuate certain already existing lines and folds, but making them severe as we get older. At the same time, what is also really important to understand is that the actual biodynamic behavior of our muscles is changing. So the resting tone and the amplitude of zygomaticus major muscle, which is the most important muscle for us to smile, to convey positive feelings and expressions, starts to reduce as we get older, which means that the actual amplitude of positive expression that we see in patients as they get older gets diminished. So it's not only the static change that we see, which is causing midface volume deficiency, as there's not enough pull by zygomaticus major muscle on the overlying soft tissue anymore, but also really in nonverbal communication. And then there are, as we already said, changes in fat, but not only in the superficial fatty layer, but also in the deep fat compartments. We do see a general atrophy of those deep fat compartments, especially in the SOOF, the suborbicularis oculi fat pad, which kind of alters the whole scaffold of the underlying projection and structural integrity that we can find in young patients, which give us good projection at certain strategic beauty points. Now, what is kind of below the subcutaneous and the muscle and the deep fat is the actual bone. And this is something we often forget about, as in our disciplines often there are not many maxillofacial surgeons, but rather plastic surgeons or derms, which are more concerned about the soft tissue. But the bone is one of the most integral parts when it comes to understanding facial aging, and we can see, especially in patients from an Asian descent, that an already flat midface becomes even flatter as we get older due to maxillary retrusion. And then there are also obviously certain changes in the mandible down here where we're losing mandibular angle definition, also certain protrusion of the chin as we get older. So the anatomy does not only kind of dictate where we do have to inject at the end of the day in terms of danger zones and non-danger zones, but also in terms of what is the underlying pathophysiology of changes that we see as we get older. As we're speaking about risk-balanced and safe injections, however, we also need to take into consideration the vascular anatomy, and the vascular anatomy for a simple reason, because we do want, at any case, kind of avoid any necrosis, occlusions of the vessels, which also could lead to blindness. And most of the cases of soft tissue filler-induced blindness is not only HA, also collagen stimulators, also fat, have been reported in the Asian continent. So there is a certain tendency where we need to be a little bit more careful in terms of the anatomy. And one of those reasons is that the vessels in general in the Asian faces are significantly bigger than in Caucasians. The reason for this is not quite known, but there are first studies which show that obviously the diameter, especially of the arteries emerging from the ophthalmic artery, are bigger, which makes them more prone for injection and also inadvertent adverse events that we do try to avoid. So we do have those key vessels all over the face, which we would need to try to avoid at any cost. And if we look at the glabellar region, then obviously the vessels we try to avoid to hit are supratrochlear and supraorbital artery. As in all of those depictions, you can see that there's always one main trunk of those arteries emerging from the orbit and then kind of moving along the forehead, giving its course a certain area of perfusion. Now, important to understand is that we, in most of those depictions and images, show the main trunk, but there are also many small, tiny vessels that are emerging and originating from those main trunks. However, in general, the supratrochlear and supraorbital artery are emerging from deep down the bone, passing through the muscle, becoming more superficial. So in the lower third of the forehead, in the glabellar region, you can find the vessels deep, while they're then becoming, at least the main trunk, more superficial as we move in a cranial direction. Nose has been identified as one of the highest risk indentations that we do have, and we can see that along the nasal dorsum, especially in the midline, it's a rather avascular plane in the deep parts of the nose. However, as we move more superficial and a little bit more lateral, this is where most of the times we do find the dorsal nasal arteries. So this is one of the main reasons why we need to stay in the median or slight paramedian plane when it comes to nose injections and don't go too lateral. While the temple has become one of our key areas for volumization, we do need, however, to be aware that there are a plethora of vessels, especially superficially within the superficial temple fascia, the anterior branch of the superficial temple artery, which is running in a 45-degree trajectory between tragus and our forehead, where it merges the supraorbital artery, but also in the depth where we do have the anterior and posterior deep temporal artery, not only running on the periosteum, but rather really going into the temporal muscle itself. And then last but not least, also in the midface. Most people are afraid of the angular artery. The artery that we really need to be afraid of, as it is a branch of the internal circulatory system, is the infraorbital artery. And while traditional mapping has been kind of given to us and indicated that it is always in the mid-pupillary line, we do know at this point that the infraorbital artery emergence can be basically anywhere along the inferior orbital rim. So this is also a danger zone that we need to be aware of. Apart from the anatomy itself, we also need to be aware that there's no single Asian aesthetic ideal. So there's only an aesthetic ideal for the individual patient. And by taking all of those anatomical key features, safety points into consideration, you have a much easier time actually reaching to this point. So there are a plethora of traps which we're going to encounter in the next couple of minutes that kind of might alter an outcome in a wrong direction. But what is really important before you actually even choose the product that you're going to inject is that you really look at proportions of the upper, middle, lower third, that you do hierarchy the features in the correct order, and then make a treatment plan based on the right product. We're going to deep dive into the actual portfolio and the available SKUs a little bit later on, but obviously we need to kind of also adjust the product choice to the underlying anatomy. So a product with a small particle size can be easier injected in the more superficial parts rather than a product which has a higher particle size or a higher coercivity. You can see right here that over the entire Revenus portfolio, you have, based on different HA concentrations, with Revise at 12 milligrams per milliliter and Kiss Ultra Contour Outline and Shape at 25 milligrams per milliliter, a wide array, as the particle size is changing over the portfolio, and also the amount of additional linear HA, which also alters the rheology, is kind of changed along the entire portfolio. What we see is what we get with the PROLLENIUM portfolio, and one of the main reasons for this is the milling process, which is going to later on be explained by Dr. Shangli Lin from Taiwan. But you have very precise results as the water uptake with the product is very limited. And this links back to the first slides where we agreed on that we're shifting from a pure volumization to rather an optimization in our patients, where we need to respect certain integral pillars of anatomy. This being said, when we go into the Asian beauty idea and we're altering this using HA neuromodulators, EBDs, collagen stimulators, we need to be aware that safety is a competency. It is not a precaution. This is what many people get wrong. It's the absolute minimum that you need to offer to your patient. So how can we increase the safety? By understanding the underlying anatomy, by sometimes performing vascular mapping using ultrasound, by having hyaluronidase at our hands all the time, then by using mitigation or risk mitigation strategies like aspiration, by altering our injection speeds in certain specific regions, and also by positioning our patients upright during nasal and periorbital injection mainly. This being said, safety is not only about avoiding adverse events and complications which are kind of technically induced, but also by avoiding complications which are aesthetic, which means that you do not overtreat your patients, that you respect their individuality, and that you respect their anatomy. With this being said, it's my huge honor to invite the next speaker to the stage, who is Dr. Shang-Li Lin from the beautiful city of Taiwan. He's one of the most respected speakers in the Asian field, and he's going to speak about how he decodes the rheology, there we just have set the tone, of the PROLLENIUM portfolio to integrate it into your Asian patients. The stage is all yours.
Good afternoon. So knowing all that important anatomy information, I think and after knowing that what happens in the aging process, I think what we need to know how we incorporate such information and combine it with the proper choice of filler that are used for the treatments for different layers of our skin. So I'm a dermatologist based in Taipei, Taiwan. So before that, here's a question we need to think about. Does a filler always volumize? Yes, they have volume, but due to the different rheologies of those fillers, we not always use them to fill. Maybe in the past, we use it to fill mainly, but it's already past the era of chasing the lines. So we sometimes use it for volumization, but we also use it to support certain important skeletal structures, especially for Asians, because sometimes for Asians we tend to have a flat central facial area. So to use a proper filler to support this area would be important. And in the aging process, we lose this volume. So for some facial areas, that also needs to support as well. And even more, we need to use filler not just to support, but also to create some lifting effects by placing the product properly. And most importantly for Asians, in the aging process, we tend to look heavier in the lower face. So if we are able to use the proper option and place the product in the correct layers, we may be able to create some slimming effect even after you add volume to the face. So to be able to do that, we need to know the anatomy. We need to have a proper product because you need to know what you are using and what the product features that you want to use it for. And then we are able to inject less, to inject smart. So to achieve these results, when we are trying to support our tissue, we may need to know where we want to go. So the supraperiosteal injection is one of the important injection technique. And in addition to that, we may also leverage the interfascial plan. In some areas, that's also a plan that is utilized for facelift. The only difference is that for the facelift, they do dissection, they do fixation, but even without such, we can also utilize it for certain lifting effects. And after that, if we can manage to maximize the result in these interfascial plan or gliding plan, we can achieve certain lifting effects. So with a good product, we can achieve a different concentration of HA, different degree of cross-linking. We have quite many options that we can choose to place in different layers, so we can achieve the result that we want, because they have all different characteristics. It involves the G prime, G double prime, and also the swell ratio, which is also very important. And then we have the good viscosity, lifting capacity, and also the degradation time is also different. So for in the portfolio of PROLLENIUM, for different products, they go through the compression test to test the lifting capacity, because the lifting capacity is not solely determined by the G prime, which is elasticity, but also the cohesivity of the gel, which is the thickness of the gel. Because even compared with other available products on the market, even they have higher G prime, that doesn't translate into a higher lifting capacity, because that we also need to take into consideration the thickness of the gel as well. And most importantly, as Constantine mentioned earlier, we need to be precise. So to be able to be precise, we don't need the product to have high water absorption. So not just to be precise, we also should be able to see the immediate correction, and then combining the properties of the product, we also want the product to stay in place. So to be precise, to have immediate correction and the product staying in place, then we have a reproducible and long-lasting result. So coming back to rheology, we have G prime, G double prime. For G prime, it means the elastic modulus. It means that tells us how much a filler behaves like a spring. And for G double prime, it tells you how the product flows like fluid. So if you put the two numbers together, G double prime over G prime, you get a 10 delta. So the 10 delta tells you that how much the product flows like water, or it stays in place. So this is quite important in addition to the degree of cross-linking. So speaking of cross-linking in the manufacturing process of readiness, they have different degrees of cross-linking to make the gels have different degrees of firmness. And in addition to that, not just to have cross-linking in the molecules, but you also need to have the effective cross-linking, which is called true cross-linking. If you have true cross-linking, you won't get entangled product. And then the cross-linking makes much more sense and much more efficient. And then we need to have a balance between over cross-linking and too low cross-linking, because we need to balance to choose the proper viscosity and elasticity of the product. So in the series of process of manufacturing, then it goes the wet milling. In the wet milling, it gives the particle, the spherical particle, gives a product of the shape of the spherical product. With this shape, it allows you to inject more easily. And if you are able to inject more easily and smoothly, that's the beginning of precision. Because if the extrusion force is not consistent, you may have too much in somewhere and too less in somewhere else. So this is also very important. And for different products, of course, the shape is consistent, spherical, but the particle size can be different. So for softer product, it gives you a better tissue integration because you need to use it to correct fine lines, and such as the lips and also some hollowing areas. But for larger particles, you need to be able to use it to support, to inject deeper. So, and also for the spherical shape of the product, that gives you a better biocompatibility. Because as we know, it doesn't matter which kind of product you inject, the smooth surface is always a very crucial part to less immune stimulation to the immune system, which is very important. And then the product goes through dialysis to wash out the unnecessary BDDE, and also they do pre-swelling to make sure that what you see is what you get. So in terms of the swell ratio, this is why the product is so precise, because after injection, we don't want to see the swelling. So we don't want you inject 0.1 and then it becomes 0.3. So the swelling ratio for the product compared with other product on the market, it has a very good number to make you, to give you, to be precise. And then it adds some linear HA to helps you to inject more smoothly. So you have the whole portfolio of the product that has different characteristics, but they also share similar properties, which is the precision and easy to inject. So if you put the product together, you will see this rheology position map from the product that has higher viscosity, more lifting capacity. You have shape and outline, and then followed by the contour, ultra, keys, and revise. So if we translate into the different layers that you can use in your skin, your anatomical structures, deeper we can use shape or outline, and then for the ultra, we use it for the mid-dermis or to dip dermis, and superficial, we can use revise. So how do we incorporate such different product options into an Asian face? We need to know the differences of some characteristics of the Asian face. First, Asian face tend to have more retrusion maxilla, flat forehead, short chin, and even the nose. So with all these skeletal characteristics, you are able to see some signs that tells you the story. For example, due to the lack of support in the medial maxillary area, when we tend to have the tear trough earlier, and also due to the weaker support, the lips is more pursed, and also that changes the proportion of your lower face. So observing all this information, and then we get to know what kind of product we use for different layers of our facial structure. Because the major role for Asian faces is really associated, quite a lot of part is associated with the bony support. So the bony support is what is also important in the aging process, because for those who has good skeletal support, they tend to age slower. For those who have weaker skeletal support, the aging side starts earlier because they have lack support, and then they don't have the good definitions as compared with those who has good skeletal support. So when we translate that into our injection strategy, in Taiwan, we only have ultra and the shape so far. But that is already quite enough, because for shape, you use it for deeper skeletal support. For ultra, you use it for soft tissue. So you can separate the two options and then put them into two main layers. So let's have a look at this first. 30-year-old male. So he is a good example of weaker skeletal support, especially in the mid-face and the lower face. So that gives her face a more rounded shape and lack of definition. But if we to correct that, we start from the temple, that we place the product deeper on the bony area, and then if we want to add a second layer in the interfascial plane, we can use ultra. So with 2 layers, minimal amount, then we are able to have the support in the 2-layer fashion. And if you have a look at the infraorbital area, you can see the mild eye bags due to lack of support in the zygomatic area and the maxillary area. So this is a good place that we place the product to resupport this area. And then we correct the medial maxillary area and the chin area. So this is a result that I get 1 week after the injection. And if you have a look at the profile view, the lower face definition improves a lot, and the facial proportion, without doubt, is the most important. And by choosing the product wisely, you get to have a lasting, and the shape remains the same. It doesn't migrate, and it's precise. So from 3 months all the way to 5th months after injection, you still have very nice definition of the face, even for the lower face that requires larger support from the product. This is the second case, 42-year-old female. So apparently she has early aging signs, mainly in the medial maxillary area. And she already had the weaker skeletal support in the beginning. And due to the asymmetry of the face, you can see her right face has a weaker skeletal support compared with the other side. So the strategy for her is to rebuild the skeletal support from the temporal area, mid-face, and all the way to the chin. And then for some facial areas, such as temple, the medial cheek area, and also the chin, we can use Ultra for a second layer. So you use small amount for every injection point, and you add a second layer, and you get a very nice stacking result by placing the product in different layers. So this is the result 3 months and 6 months after the treatment. We can see the facial shape is more symmetrical, and we got more eye opening effects, and also she has a much better lower face definition and shape. And if you have a look at this oblique view, the lower face becomes less heavier due to the improvement of the facial definition and support. So knowing all the information, and we have a product that has good rheology, is just not just a lab number, but also it helps you to have a right clinical decision, and it gives you a good framework for the option of the product. So thank you for your attention.
Thank you so much, Dr. Lin. Our next speaker is a local speaker, fortunately, from Thailand. It's Dr. Thanawat Yotagari, and I had the pleasure to work with him the last couple of days in a Train the Trainer and also in an anatomy course. And we're more than excited to hear about how he's using his beauty ideals and the clinical experience with the Revanesse portfolio in his clinic right here in Bangkok, the Chance Clinic. Dr. Tom, all yours.
Good afternoon. Hello, Sawadee Krab. I'm Dr. Thanawat from Thailand. I'm very glad to be here today. Today I'm going to share with you about my perspective on the beauty concept of Thai and a patient from the Southeast Asian. Today I'm going to give you some kind of tricks and tips about how I prevent the overfilling in Thailand, which is a very big problem right now. Okay. First of all, I would talk about the dynamic of the beauty concept of the Thai people. Okay, it has changed a lot over the past 10 years. Like 10 years ago, injectable is not that available and still expensive. But like 5 years ago, it is more like cheaper and more available, and people start volumizing it. And it was the start point of the overfilling right there. But right now, people are focusing more about the word facial harmony, which is very new in Thailand. And the situation is getting better. Many Thai celebrities and influencers come to me and get things dissolved and start things out again. And I highly agree with Dr. Constantine about the concept of the anatomy, because I think from my real practice, I always focus on the objective anatomy rather than subjective beauty goals. Again, objective anatomy rather than subjective beauty goals. Okay, the goals of the patient is important, but we need to understand that the Asian skeletal structure is different. You need to understand that how much the anatomy allow you to go on each phase. This is very important because in terms of safety and in terms of not to feeling so much. And why the Asian face is quite prone to overfilling. I really mean it. The reason because we originally have quite small eyes and flat nose, frankly. And according to the psychological science, the eyes and nose are the very first organs that is recognized for facial recognition. So anything that shifts your focus on the nose and eyes will always lead to overfilling. Like if you inject only 1 or 2 cc's of the lips and it's still seen from the nose, I always consider that overfilling. Just only 1 or 2 syringe. And I put a small experiment on the ChatGPT. As you can see that I put a very similar girls together, the one with the prominent beautiful eyes, eyebrows, and high nose projection, but with the other girl, it had relatively smaller eyes and flat nose. And I ordered the ChatGPT to put the very same volume on the lips and cheek, so you can see the final result with a similar volume. So for my practice, apart from seeing the whole picture, I always see how eyes and nose play a role on each patient, because if you have a start point like very small eyes and nose, so this is the anatomy is telling you how much you can really go with them. So this concept is not only for Asian, but I think it can apply like globally. Okay, next, for the patient assessment, I believe that the global assessment is the most difficult part of the filler injection, because the right assessment will lead to the right diagnosis. The right diagnosis will lead to the right choice of filler selection, like in the portfolio of the revenues. So, and can give you opportunity to use less to prevent the swelling, overfilling. But by the way, despite you have a good choice, the best technique, and the right anatomy before injection, however, when considering about the lymphatic drainage, which is very new in Thailand too, I always talk about this, even you do the thing very, very right way, but finally, the original anatomy, for somehow don't really allow you to inject to block the lymphatic vessel. So this is very important thing to consider. And like injection for the small area like just lips and chin is quite easy for me, but when it comes to blending them together to the whole face, I think it is the hardest part. And like I had an opportunity to talk with like a junior injector. They always had hard time describing the whole face, because I think when you have to blend things together in each feature, so like the interior designer, it is quite difficult because it requires a lot of information, a lot of knowledge, and it really requires a good test for the total assessment. So this is what I'm doing in my practice. First of all, the white line, the midline, so at least you need to access the symmetry proportion together with the projection, which is a very big problem of the basal skeletal bone, because we have less projection. So we need to balance. We cannot see from this slide, but the 6-part of projection is about forehead, the nose, lips and chin, and the middle cheek. The second line is the purple line. It is the origin line. I always consider them from the hairline down to the mid-face, along the chin. And this line have to be quite moved immediately after injection to make the face slimmer and longer, because in Asian face we have like flat and short face, right? And the green one is the entry point of the cheek, which is very important because you need to put them slightly medially, but not too medial because of the swelling issue. And it needs to be very staying in a good flow without disruption or the deviation. And it needs to be blended very well with the medial lateral mid-face together with the lower zone of the temple. The last one is about the transitional lines, the green. The yellow one, try not to put so much volume on the lateral face, but just trying to create a good transition of each part of the face. This is my tips. And one thing which is very important in Thailand, because we have a very wide range of like gender issue. Sexual dimorphism is not just about being masculine or being feminine, but it's much more than that. By the way, biological sex is actually different from the gender identity. And the gender identity is actually different from the gender expression. So every time I think it needs a dialogue and understanding to for a consultation, because sometimes the LGBTQ just come to me and just tell me that I want to look better, but they cannot really explain what's going on or what they really want. So many times we have to deeply dive and actually have to help them shape what they really want to look like or how you really want, because filler injection in Thailand is very sensitive. You need to know more, so much about the several dimensions. And for the assessment of the whole face, the whole picture of the lateral face, I think, have you ever seen someone from the lateral face and you instantly realize that, okay, you are good looking by just seeing them from lateral face? You know, like for the profile view, I still put a priority on the nose and eyes. So anyone like celebrities in Asia, in Chinese, or in Hollywood, they always have a good harmony in lateral face. You can still see and recognize them for just looking at the nose and the eyes and eyebrow. The first one is that, like, if you inject too much forehead, which is very common in Thailand, or inject too much lips or chin, it will still design. Your nose will relatively smaller. Or when you're trying to put the 100% of the corrections of the middle mid-face or under eyes, the size, the relative size of the eyes will appear smaller, which is very important. And the second thing, which is a very common pitfall in Thailand, is about the position of the apex of the mid-face. For me, my formulation is that I always put just more than 80 or 85% of the length between the lateral canthus to the jawline. This is very important because the whole concept of the filler injection is that you try to put too much volume on lifting, but in fact, the filler itself cannot really lift your face. You can just reposition and put some camouflage or some like the changing the lines to change how the brain perceives. And the last thing is small trick, but very important, is that if you consider the slope of the forehead, the slope of the mid-cheek, and the slope of the jawline, the ramus of the mandible, and they have to be to go together. Finally, the concept of the superlateral injection is very important to reposition the face, but do not inject too much on the lateral. Like in this case, I just put 5 syringes of the shape, focusing mainly on the deep plane. And the key message is that never ever make the patient's eyes and nose look smaller. Thank you.
Thank you so much. I think this was very insightful for all of us. And now, last but definitely not least, I have the great honor to announce not only a mentor, friend, but also globally esteemed colleague, Professor Ophir Artzi from Israel, from Tel Aviv.
I hope they are awake. All right.
You'll wake them up.
So I'm going to tell you, I've been in this market for the last 17 years. You've seen me with QMed, Galderma, so many companies, so many laser companies. I'm going to tell you all the secrets. I'm not going to talk about anatomy is doing it better. I'm not going to talk about Asian face. You do it better. But I want to zoom out and to show you how actually you should do it using this product, but not just this product. Unfortunately, we all age. This is inevitable. And it's not just now. We all want to maintain very good skin quality and to look refreshed and young. And this is the reason why our field is blooming, evolving. However, be honest with yourself. Most of your patients are actually undertreated. Why? There are 3 different, I would say, fundamental failures. One is the thinking, the strategy, and you will understand in a second what I talk about. The second is how you do it in the end. And the third is the environment, the thinking. Do you really think, if we talk about the aging process, this is a train running and you run after this train, do you think if your patient comes once a year, he or she will look younger? So if it's just an isolated treatment, no anti-aging. Do you do plan? Raise your hand if you do a 2 years, 3 years plan in advance and actually the patient know about the plan. You understand what you do. Some of you do not know the pathologies. When I train you and I ask you, what do you treat here? You are not familiar with what you treat. So this is in regard to the thinking. Let's talk about the clinical mistake. You know, you have tools, you have to use them, but you have to use them in the right sequence. You cannot over-repeat fillers. Of course, you will have overfilled syndrome. You cannot over-repeat biostimulators. You will have inflammatory reaction. You cannot really avoid or refrain from using one tool, then again under-treated. And the main issue is probably what we get from the environment. Kim Kardashian is posting a specific treatment for cellulite. I don't have cellulite, but I want to have Kim Kardashian's treatment. So it's all about the environment, what the company says, the brand, the social media, the celebrities. This is not science. Now, I have been in Asia for the last, I have a flat here in Bangkok, so I travel here quite often, and I hear no to fillers. Come on. Even if I Google, and this is from ChatGPT, you have the terms in Thai, in Chinese, Japanese, Korean. There is a term for overfilled, and this is all just from Asia. Okay, I digged in to see different, I would say, report. Don't use, oh my God, it's going to ruin your face. Come on, don't blame the nail. Of course, you can use many nails on the wall. And if you're not talented enough, you will have to really, it will look in the end awkward. But if you're precise and you use one nail in the right area, it might be very beautiful. And it's the same for HA. The problem is not HA. I have been in the market. I'm part of different HA development. I know the market very well. It's you. It's the overfilled. It's the wrong combination. It's the wrong sequencing. In the end, if you know the anatomy and you choose the strategy and you respect the Asian, I would say, face, then you're going to have very good results. So let me teach you how to really do it. Whenever we talk about treatment philosophy, first you have to understand that aging, this is not just a face. So if you got married to or you work in a work that you don't like, you don't drink, you don't eat, you are going to age because it's systemic process, and skin is just part of it. If we talk about aging and you have to actually explain your patient, it's a journey. It means that now I meet you and we are going to have a long-time relationship, because if you want me to maintain and to improve your skin quality, you should be treated until you die or you decide it's not important for you anymore. The skin is the largest organ in the body. Let's say that you want to be in good shape, all right? Heart. Do you run once a year? No. So you do something every day, and every week you challenge yourself, and every month, I don't know, you do some more kilometers, and so you have to challenge yourself on a daily, weekly, monthly. So this is part of the game, and it has to be delegated. You have to explain it to your patient. And one of the things which is important, you have to look very well at your patient. What are the pillars of aging of this specific patient? Is it structure? Is it skin quality? or if is it tone? And if you want me to get into details, structure, it means loss of shape, volume, some contouring issue, disproportion. If we talk about skin quality, this is texture and wrinkles and pores and scars and you name it. And of course, you understand the tone, this is blood vessels and pigmentation. Now, where to begin? Whenever you see the patient, and I remind you, really plan in advance. Have a look and say, this patient, I'm just pointing, yeah? This patient is a structure. This patient is skin quality. Here I see pigmentation. So you know where to start. What is the dominant pillar from which the journey will begin? Now, if it's tone, it's clear, right? What we're going to do. We're going to do vascular laser, IPL, BBL, whatever. This is for sure, you understand it, all right? If it's skin quality, all right, you can do many procedures. Mostly it's a surface issue, so you want to resurface. It's mostly lasers. However, you have different modalities and different injectables which will improve skin quality. But what would you do with structure? If there is a change of structure, you have to use other devices, either liposuction or the deep devices which tighten, or threads, or, God forbidden, you have to use fillers. Otherwise, you are not going to have result. I have the privilege to treat this patient with Dr. Wanrawi. I was a month ago, 2 months ago? 2 months ago. So this is the patient. Let's have a look. This is a structure problem. This is the first pillar. So you see mid-phase depletion. Again, you always, I recommend you, first from the medical point of view, so whenever you write, so afterwards in court, they see what you saw. Second, when you write, when you have to describe it, it's easier to find solution. So let's do it together. There is mid-phase depletion with the accentuation of suborbital fat bulges. 1. Second, if you look, what do you say about the chin? Retrognathia. So he has chin which is going backward. Have a look, you can see it from a different angle. There is some loss of jawline. And if you look at the temples, it's very skeletal, all right? So there is a skeletal or there is a shape change. So in this patient, for sure the first step would be fillers. Half cc of shape here with a needle. Half cc with shape here, all right? This is the beginning. Then we did few entry points, through which here we went to the supraauricular area. I love it in Asian patients because you can't see it and there is some reposition. I don't call it lifting, reposition. Then what we did, this is an entry point through which we use 1 cc of ultra so you can see the areas that were treated and some points at the corner in order to elevate the corner of the mouth. 5 milliliter per side, 10 cc altogether, before and after 1 month after treatment. Again, you can see, have a look at the chin. You can't really achieve it with any other modality. Again, have a look at the correction of jawline. Have a look at the change of the temporal fossa and the temporal hollowing. Here it's even more prominent. I'm sure you agree that she looks much more beautiful. Couldn't I do it with polynucleotide? No. Could I do it with lasers? No. So whenever you have the tool, you have to use it. And it's not just me. This is another case from Dr. I will try to pronounce this, Panitachanat, nearly, all right? But you can see, again, very nice result, same. Structure problem will be changed if you use material, tools, we change structures. Now, let's organize it. Whenever you see your patient, you have to look at your patient and you have to plan 2 years in advance. This is the minimum. I don't really plan more, especially with this era of GLP-1, because people change, depressed, get married, get divorced, so they change. So every 2 years, I think we deserve reevaluation, but 2 years, it's minimum. The first year, this is the year of transformation, reset, in which we're going to make a change. Then in the second year, we are going to optimize, we are going to maintain the result. Now, where to start? I'll give you an example. So if it's a tone, we said the first modality will be probably vascular laser. And then we are going to have all the regeneration and the structural fix with fillers. For example, this was the first one, the first treatment was IPL. We began from this treatment. We did some other treatment afterwards, some fillers, but the first treatment was IPL. If it's skin quality, problem of surface, the first one will be resurfacing. So you can choose whatever you want. Fortina is here, maybe she would use chemical peel. I would probably use lasers, but you want to resurface the skin. And then I will use different regenerative, I would say, tools, and I will use different structural, I would say, corrections and toxin if needed. For skincare is always needed. This is, for example, in the beginning we did, in here this case, hybrid lasers, and then followed by fillers. You couldn't really achieve good results with any other combination. And if it's structure, I showed you. I have to choose modalities which will change the structure. So either liposuction or X-assisted liposuction, choose whatever you want, or threads. But fillers are so easy, you have to use them. It's beautiful. This is only fillers as the main modality, but we do combine. For example, this patient is the combination of liposuction, what we call, this is quantum RF, this is radiofrequency liposuction, together with fillers. You can see the results quite dramatic. This is HIFU plus fillers. Again, you can see the results from different angles. And this is from Thailand. Have a look at the very nice result of the combination of, whenever it's, again, we talk about shape, it's HIFU and fillers. This is not a magic. This is, if you understand the reality, you're going to do it very, very well. Now, the second year, to complete the story, then you optimize, maintain. So if still there is a shape problem, you will add some fillers or other modalities which will change the shape. If tone, of course tone. And if surface, you will choose other modalities. And I will end up with this example. This has been my patient for the last 7 years. And I'm going to start with you 7 years ago when I saw her. So now she's your responsibility, your patient. What are the main pillars of aging? So the shape is relatively preserved. I'm sure you can see pigmentation. And I'm sure you can see some skin quality. So in her case, the first year, I remind you, reset, transformation, I always plan 2 years in advance. You don't talk to me, okay? And plus, after waiting list of at least 1.5 years to see me, you are going to, you want me to plan a 2 years plan, okay? Because the next time we are going to reevaluate, it's going to take many months ahead. So this was the first treatment, IPL followed by hybrid, followed by PDRN, same treatment. In order to prepare, but again, this is maybe too much for this symposium, we prepare, we prime the skin. So what we do, usually before treatment, we do kind of a treatment with PLLA and toxin to prime the skin. Of course, we complete the treatment along the year. And because there was resurfacing issue and pigmentation, so we did some IPL plus, and of course we did some toxin and structural fix. So this is shape, contour, and revise 6 syringes. So this is her before, 4, and 12. And you can see her from different angle. So 0 to 1 year. We succeeded, we evaluate. And then the second year, it's the year of optimization, maintenance. So you can do whatever you want, but for example, in this patient, what she got, we didn't do filler here because she didn't need it. We didn't need any other structural change. We did another session of PLLA along the year, and we did, as you can see, this is a combined approach in which we do IPL followed by HIFU, followed by non-ablative. We did it once a year, but usually we recommend 2 years. And then every year, the third year, the fourth year, the fifth year, we did the same. We injected some structural fix because it's a must. We inject some PLLA, and she got some, I would say, resurfacing anti-pigmentation. You can see the combination. So this is after 5 years. So this is before, and this is after 5 years. This is, again, before, and this is after 5 years. So my friend, I'm here for PROLLENIUM because this is a very good company. However, whenever I hear, AJ, no, overfill too much, I'm scared, oh, no, my friend, don't blame the nail. There is a saying that anyone can hammer more nail. Professionals knows exactly where to place them. So place your fillers very, very accurate in a precise way. They are not the problem. We are the problem, all right? If we use too many, too much, too repetitive, only fillers, we don't use other modalities, we don't understand the pathologies, we don't plan, there is no rationale behind our treatment, then we fail and we ruin the market. And in the end, I told you, the problem is misuse. So it's the technique, it's the quantity, and it's the brand. I have been speaking for, I won't mention other companies, but for many companies. Nowadays, in my clinic, and you're more than welcome to come and visit, if you open 60 to 70% of the syringes that I inject daily, and when I'm in Israel, I inject around 100, 150 cc a day, all right? A lot, okay? But I see 80 patients a day, all right? So 100 to 150 syringes a day, 70% are PROLLENIUM because they're, I would say, what you see. Maybe this is the most important. What you see, it's what you get. I have no swelling. I feel it's safe. And this is the hammer and the nail that help me to fix the shape problem of my patient. Thank you so much.
Thank you so much, Ophir. So this concludes our symposium. We have around a couple of minutes left because there's nothing after us. Do you have any questions at this point? Yes? Yeah, sure.
Thank you, Professor Ophir. It was very interesting, but I have one question. You have seen, and we have shown the picture, first patient, what you have done, and you say that you used here shape and ultra. So, because of reconstruction. So, what about the contour and outline in that case? Why you decided in that patient to use ultra?
It's a technical issue. You know that in Thailand, they have only shape and ultra. If it was my patient in Israel, I would have used different products. In Israel, we have all the products of PROLLENIUM.
Okay.
So I can choose whatever I want. But here you have to understand that when I came to our clinic, they gave me 6 syringes of shape. This was the budget, I think, or 7, and ultra. And I said, that's it. These are the only. But I think now you submitted it, so probably they will have more material. However, for your question, I would probably use different ones.
And one more, please. Because of that, you tell us that I will tell you all information about this brand and some secrets. And your secrets about the outline and contour, exactly in your patient, in your clinic, what's your main idea to make difference on exactly on this
It depends on the patient.
because we know that 4% of additional lines, the rheological we know, but the main secrets in your practice.
I actually interchange or mix between shape, outline, but again, it's like most of you, they don't have it. But it's like, do you know all the portfolio of the company? So, but again, generally speaking, if we talk about the more rigid, I would say, AJ, so there is even another one, there is Scalp, okay, which still it's not even Asia. But we have many, okay, let's say it's outline, shape, and contour. Contour is a little bit softer. I use it, for example, for this area, the temporal area, if I have thick skin.
Yeah.
I was scared she wasn't my patient, thin skin, and afterwards, one hour we will have to deal with her, so I used Ultra. And Ultra for this area is great. But whenever I want to really have it, let's say in a thick patient, contour, this is the material to be used. Outline, I love it, or shape, to create kind of a lifting. So when I use it either on bone, on swift point. Do you know what is swift point?
Yeah.
On swift point, so I use either the shape, or mostly
Outline.
I use the outline. I love the outline for the contour. But again, it's very difficult to tell you because I look at you, I touch the skin. If it's a thin skin, I'll choose different.
So it's depend on the anatomy, on the visual effect first.
But I do have to say that generally speaking, this material is very forgiving as compared to other material that I know in the market. So even if you're wrong, massage will make the difference. There is a very good tissue integration.
Because it's really important for us.
Yeah.
Sometimes they don't understand why and so on. Thank you very much. It was very interesting.
My pleasure.
Thank you. With this being said, we're going to be at the booth later on, so if there are any questions, we're going to be at your disposal, or you can obviously reach out to your local PROLLENIUM sales reps. Thank you so much for putting the trust into the 4 speakers of us to the PROLLENIUM team, and we hope we could convince you that we're progressing in this field, and obviously for any other questions, we'll be at your disposal at the booth. Thank you so much.